You seriously never know if you're going to be the next patient at the hospital.
One of my boys was calling me to come. Daddy wasn't feeling good, so I went upstairs to our bedroom. Then he started to complain that he was feeling the tingling sensation in his arms, so we immediately called 911. It was a feeling of relief that he was in good hands and that they were going to do everything they possibly could.
They actually send the EKG to our computer. The cardiac cath lab is ready to go.
I just kept thinking of the kids and myself and what was I going to do.
One of the 3 arteries in his heart, the one which supplies the front wall of the heart muscle, was 100% closed, and that was the cause of his heart attack.
One of the doctors came in, explained that the stars were aligned because everything kind of fell into place, and clear his blockage within 59 minutes, which was phenomenal.
When I went to get Davis out of the car, he was catatonic. I went through the doors of the emergency room. The response was really phenomenal. There were a group of nurses who took Davis from me.
I checked for a pulse, and he had a pulse, but it wasn't a strong pulse. We got him on the monitor. We noticed that his blood pressure was through the roof.
You know, there was a real desire to problem solve, you know, to leave no stone unturned, so to speak.
It was found that the child had glomerular nephritis, which is a condition that develops when strep attacks your kidneys.
One of the nurses, she came over and she put her hand on my arm and she asked how I was.
You want to treat this child as if it's your own. You want to make sure that this child is going to be fine because you know that that parent, that mother, that father, they're going to suffer if anything happens to their child.
They treated me like I was one of their own.
It can happen to you, regardless of what you feel about yourself. I felt I was invincible, and you know, I skirted death.
I really think the team in the emergency room, we have all the great equipment, and I think that was a significant reason why the child was saved.
For us, it was another day, and it was, you know, but for them it wasn't. For them, it was life-changing.
Had he not received the treatment that he got at the time he got it, he wouldn't be with us today.
The idea that a hospital like ours with such exceptional care can contribute to this community over 120 years is in of itself a remarkable achievement.
And the hospital has changed dramatically from a real sleepy community hospital, high quality, special place, to a thriving, real tertiary care hospital.
We've truly found the balance between providing state-of-the-art care, but making sure that it's personalized.
And we haven't grown so big that we've lost that. So what we've been able to bring together is the high tech of today's healthcare world with the caring and great experience and even better experience by our doctors, by our nurses, are just spectacular. And the experience of our patients and their families just gets better every day.
At White Plains Hospital, we're redefining community healthcare. And that is made possible because of the advances in medical care, our recruitment of top physicians, and our incredible staff. There's so many examples of the care we're now able to provide.
We have patients who are in cardiac emergencies, having heart attacks or cardiac arrest that may have been brought to our hospital years ago, and without our new cardiac catheterization facility, would not have had the type of treatment that they now enjoy, which has been life-saving treatment.
Today we realize that it's very, very important to treat each individual with a diagnosis of breast cancer or undergoing breast surgery for prophylactic reasons as an individual. It's always our goal to, number one, treat the cancer appropriately, and number two, to always optimize aesthetic outcomes.
We know that to care for these extremely frail babies, everybody has to do their job and excel at their job. This is about one simple mission, and that mission is to care and love for these babies as if they were our own.
It's not just the facility, it's not just the technology, but it's our healthcare professionals and our doctors and our nurses who recognize what's going on, who don't take no for an answer, who make sure we get the treatment going and save people's lives.
White Plains has been an innovator in the area of minimally invasive surgery in Westchester County for a number of years.
And over the last 15 years, minimally invasive surgery has taken on many, many different forms. And for the last 8 years, we've been doing robotic surgery.
Robotic prostatectomy, gynecologic surgery, laparoscopic gastric bypass surgery.
By using small incisions, it allows patients to return to work more quickly and recover from the surgery itself.
The big movement in spine surgery has been to make it safer and to make the surgery smaller. And smaller meaning smaller incisions, but also less rehab with less destruction of soft tissue. We have now a computerized image of the patient's spine. We don't have to make such a big incision. So we can approach the spine from just one direction, either left or right hand side, and go in using the stealth machine and do the opposite side, which is virtual surgery. Not only does it help us, but it gives the patients confidence in knowing that they're getting safe surgery.
All of these things are traditionally thought to be only done safely at larger institutions, and clearly we've been doing that here now for many years.
With the advances in medicine, the right doctors, the right staff, we also need the right facilities. That includes a much better arrival experience through our beautiful new entryway to the hospital.
And this is really about trying to create the overall environment of the hospital to make it new, to focus a lot on natural light.
Making sure that your stay is as comfortable as possible in private rooms.
Hospitals are for healing. A good environment in a hospital will enhance the healing process.
We're going to provide new, advanced, state-of-the-art operating room, once again, to give our patients the most advanced medical care that's possible.
The fact that all of the new equipment is telescoped from the ceiling allows for quicker turnover time, more efficiency.
All these things we think are important today and as we move toward the future, and it really transforms the hospital to the next level.
The reason I came to White Plains Hospital was really the people.
All you have to do is walk around the campus. The team approach at White Plains Hospital among surgeons, nurses, and anesthesiologists makes White Plains Hospital exceptional every day.
Every time I walk in here, I feel a sense of camaraderie with the people that are around. I feel comfortable that patients are going to be supported.
Having been a pediatric ICU nurse, I knew what good care meant for my patients. And today, as I look around and I see every patient that's taken care of, I know how special their experience is because of the special care they're getting from our staff.
And that's what the nurses do here. They become very connected to their patients. We believe in making that connection. It enables us to really provide the best care, not only for the patients, but also for the families.
She was in 7 weeks. You know, anybody who was there, they just stop in, how you doing? They meet you in the hall, they stop, how you doing? How's Tara? How's Danny? How's Ryan? How are they handling this? Do you need a hand with anything?
For the kids to have Dad around, I mean, words can't express what that means.
We took this man who may not have made it another few minutes, and we sent him home to his wife to raise his boys, and that's why we're here. That's the difference we made that day. And on a day like that, that's a good day's work at White Plains Hospital.
It all comes from where his treatment started and how quickly they were to act on what they saw that was wrong. And he has 3 little brothers who he's the sun and the moon.
Forget their professionalism, their knowledge of their craft in nursing. I've never found a better set of human beings anywhere.
I think the hospital has a great future. It takes private donations to make the hospital grow and blossom.
We need to raise $100 million. There are no programs any longer that will make it possible for us to raise that money or to fund that money through the healthcare reimbursement system.
I don't think we should ever take White Plains Hospital for granted. The hospital is right in our backyard. The quality of care is unbeatable.
This is the most important one, that if you should need it and it's not there, it will be the worst decision you've ever made.
We are very excited about what's happening, about our plans, about all the great things that are going on. And the time really is now for us to transform our campus and to continue to improve what we do each and every day.
The time is now.
Here at White Plains Hospital, the time is now.
Right now.
There's no doubt in my mind that the time is now.
The time is now.
The time is now. The time is now.
The time is now.
Right now.
The time is now to support White Plains Hospital.